Procedure: oral cholecystography. On the previous evening, a fat-free diet, example toast and clear tea, is given to the client. 1 hour after the evening meals, approximately 12 hours before the röntgenography, the client is given 6 tablets of telepaque by mouth. These tablets are to be ingested one by one, along with water. Care should be taken to prevent vomiting. Thereafter no food or fluid is given to the client until the X-ray is taken. On the following morning, 12 hours after the telepaque was given, the right upper quadrant of the abdomen is X-rayed. If the gallbladder has filled and concentrated the dye normally, it will be seen as a pear-shaped shadow. Then, to test the contractibility of the gallbladder, the client is fed with a fatty meal and the X-ray examination is repeated to see whether the gallbladder has expelled its contents. When the client cannot tolerate the tablets, a radio-opaque dye, example bilographin, may be given intravenously by the doctor in the X-ray department, and the X-rays are taken as an oral cholecystogram. Nursing implications. 1. A cholecystogram is normally preceded by a plain X-ray abdomen which may show opaque gallstones and render further X-rays unnecessary. 2. Explain the procedure to the client to allay his fear and worries. 3. All the medications which contain iodine compounds and bismuth should be stopped 3 days prior to the test. 4. Record the client's weight to calculate the dose of the dye. 5. If the client is prepared for the oral cholecystogram, the tablets are administered orally 12 hours prior to the expected time of the X-ray. Always ask the X-ray technician for the time of the X-ray. The tablets should be given to the client one at a time, at intervals of 2 to 5 minutes to prevent vomiting and loss of drug. All precautions should be taken to prevent the client from vomiting the drugs. 6. If the client is to be prepared for an intravenous cholecystogram, always test the sensitivity of the client to the iodine compound. During the administration of the dye, the client should be watched for the reactions. The client may have a feeling of warmth, flushing of face and a salty taste in the mouth as the dye enter the vascular system. These sensations usually lasts only few minutes and may be relieved by taking deep breaths. In severe reaction, the client may experience respiratory difficulty, wheezing, sudden diaphoresis, cold and clammy skin, urticaria, shock, and collapse. 7. The nurse should be prepared to meet the emergencies if the client develop any recessions. The emergency drugs and the resuscitation equipments should be at hand to resuscitate the client. 8. If the client has suffered from allergies previously, the doctor should be informed before preparing the client for cholecystography. 9. A light meal with the fat-free diet should be given on the previous evening. Thereafter no food and water should be given to the client until the X-ray examination is complete. 10. Laxatives should not be given during the preparation period. A saline enema may be given in the morning of the test in order to empty the bowels. Intestinal flatulence must be prevented as far as possible. 11. If the client has vomited the tablets, telepaque, inform the doctor and the test may be delayed for 2 days and then repeat the procedure, or the client is prepared for an intravenous cholecystogram. 12. Send the client to the X-ray department in time. Send fatty meal for the client after the initial X-rays are taken. 2 or 3 pieces of toast, butter, milk with extra cream and egg can make up a fatty diet. The client is encouraged to take the fatty diet after cholecystogram is taken. Fatty meal will help to contract the gallbladder, thus to empty its contents. The X-ray is taken